nutshell of polycystic ovarian syndrome. It is not always an adult disease. The grown-up child, adolescent female girl can have these things in 5 to 10% in the reproductive age, children and adolescents, the polycystic ovarian syndrome. It is basically an anovulation or oligoovulation with androgen excess both in lab and clinically, and polycystic ovary, cyst means more than 20 cysts in ovary and volume more than 10 millimeter square. Androgen is higher, obviously. So these children, the pathogenesis of the whole disease is the your deficient FSH, follicular stimulating hormone production, or response in the ovarian follicle. Apart from that, you may have little bit of luteinizing hormone abnormality. You may have the low estrogen and more testosterone. So treatment is almost lifelong disorder, might begin in the childhood and adolescence. Obesity is common. The other metabolic syndrome, the IDDM, insulin-dependent diabetes mellitus, dyslipidemia, they are also very common over here. And hirsutism due to the androgen excess in a female child, notoriously bad looking, is also possible. And so treat those cases by combined estrogen and progesterone therapy mostly, and which suppresses this FSH action, and your metformin to treat diabetes, combination drug like cyproterone and spironolactone, which inhibits androgens. The other drugs like flutamide, now they also are the anti-androgenic little bit. They are useful. So in cases of the bad sort of hirsutism, you go for the electrolysis, epilation, and the laser therapy. Maybe other therapy. Maybe the your palliation sort of shaving the unwanted skins. So they send this child to an endocrinologist, maybe to an obstetrician, maybe joint combination treatment by pediatrician, endocrinologist, and your obstetricians.